everybody. Today we are here with another role play. I have Georgina with me. She's going to take the role as an interlocutor, and I'll be taking the role as the nurse. And we are going to present you all today a role play. So, what is the role play, Georgina? What are we going to present today?
Yes, it's a role play about an asthma patient
Yes.
who recently got admitted in the hospital,
Uh-huh.
and now the patient is worried about his or her condition. So
Okay.
the nurse is here to explain about what is asthma
Yeah.
and how it can be treated.
Okay, so the main focus behind this role play is the patient is had an asthma attack, and he is having anxiety. He is worried what can happen in your future regarding his illness. So we'll see how we can do a role play based on this. Okay.
All right.
So as usual, I'm going to take the role as the nurse, and you're going to be the interlocutor. Okay.
Yeah.
Can we, I'll just prepare and then
Okay.
we'll start. Okay. Yes.
All right.
We'll start.
Yeah, sure.
Okay. Good morning, Georgina.
Good morning.
My name is Tina Thomas, and I'm the registered nurse in this hospital ward, and I'll be the one who's going to look after you today.
Okay.
I can see from your case note that you got admitted last night due to an asthma attack.
Yes, that's right.
That's right. Okay. Could you please tell me how you're feeling today?
Well, I'm feeling better now, much better.
Okay. So I'm happy to hear that you're feeling much better. I would like to ask you certain questions regarding your disease because when I came inside itself, I can sense from your face that you're looking a little troubled. Is that right?
Yes, that's right.
Yes.
Because I don't know much about asthma, and this is the first time I'm experiencing something like this.
Okay.
So I'm anxious about it.
Don't worry about it, Georgina. You're safe in our hands, and I'm here to help you out. So you told me that you don't know what asthma is, and even you told me that you don't know what are the causes. You have no idea regarding that,
No,
right?
I don't have any idea.
Okay, so don't worry. I will tell you each one by one.
Okay.
So the first thing I'm going to tell you about what asthma is. Okay. Asthma is actually a chronic disease that happens in our airway. Okay. So we have a body. What happens is you will have breathing difficulty. You will have a slight tightness in your lungs. You will not be able to breathe. Even if you want to do a small activities, what will happen is you won't be able to do because of this breathing difficulty.
Yes, I've gone through this last night.
Yes, that's what you have been experiencing. Yes. And are you aware about the causes which can happen?
No.
Okay. So actually there are a lot of causes that can lead to asthma. The first one is allergy. Okay. So if you are allergic to some dust, okay, maybe some cobwebs, or maybe some pollen grains, or maybe rugs or mats, anything, any sort of allergies can provoke you to have an asthma.
But I don't think I have an allergy.
Then that's good then. Then there's another one thing is regarding climate. Sometimes even climate changes can bring about asthma problem for some people.
Okay.
Okay. And the last thing is family. Okay, that's called as family history or maybe hereditary factors. Sometimes your dad or your mom or your grandparents or maybe your aunt and uncle, somebody who's close, blood relative, okay? If they have it, it can pass it on to you also. It's genetic. So that is also another one thing.
Okay.
Okay, so I want to ask you a question regarding your, family predisposition. I want to know is anybody in your family who's having any history of asthma?
Yes, my grandfather was an asthma patient.
See, so here comes the answer for our question, right?
Yeah.
So that's the thing. So these are some of the causes how an asthma can occur.
But I'm also worried because I've heard about people who died during an asthma attack.
What you have heard is partially correct because some people who die due to asthma attack, it's because they have not taken the treatment properly. Or maybe they would have gone into an adverse reaction of asthma. Maybe it's called as an asthma attack. But when it came to you, you were at the earliest stage and we could retrieve you at the earliest. So the major thing behind it is you need to take a sufficient amount of rest, and you have to follow all the advices and suggestions and treatments that we are trying to tell
So
you.
what are the treatments?
Yes.
available?
So the first line of treatment that I would like to tell you is the usage of Ventolin inhaler. Are you aware about it?
Yes, I've heard about Ventolin, and I've also heard about people misusing it.
Yes, the thing is why people misuses it. They do not take the medicine at the right time, or maybe they take it in a more stronger dose. That is the reason why they misuse it, because they become more addicted to it.
Yeah.
Okay, so that's one major reason. But when it comes to you, or like when we prescribe it in the perfect dose, route, frequency, and how many puff you need to take.
Okay.
So if you're going to follow the same thing, there's no question about misusing it. Is that okay?
Yeah. fine.
Okay. And I want to tell you regarding the prognosis of the asthma patients. That is, you might be wondering how long should I take the treatment, or how long should I, continue my medicines?
Yes.
Yes. So actually, it is a chronic disease. It will take some time, but it can be controlled. Okay. So you don't need
So
to.
will it be completely cured?
It will be cured, but it takes some time. So it will be under control, but you need to take in your medicines for some particular amount of time. Is that okay?
Yeah. fine.
Okay. So once again, Georgina, I think I have answered all your questions, and I think you're a little more, your worriness have got a little
Yeah, I'm
bit
a little more relaxed now.
relaxed now. Okay, so what I would like to assure you is that nothing to worry. Just follow the treatment protocol that we are going to give you. That is a usage of Ventolin inhaler,
Okay.
and see that how we are using it, and take it up at the right dose and frequency. Then things will become better for you.
All
Okay.
right.
If you need anything, there's a bell next to your bedside. You can ring the bell, and I'll be there to help you out.
I'll do that.
Thank you.
Thank you.
Okay. Well, in this role play, it is a talk between a nurse and a patient who was having asthma, right, Georgina?
Yes.
Yes. And here, Georgina was acting as an patient who was very, very anxious, because this is the first time she is experiencing an asthma attack. Okay. So she does not know how to go forward, and she is quite surprised that now she has to take in medication for a long time. She's not able to take up everything. So we are giving her a complete picture about what asthma is, and how it can be treated, and what are the causes behind it. And we reassured her, because this is a long-term perspective. Okay, we cannot abruptly tell the patient, you have to take the medicine for complete lifelong. That's very harsh.
Yeah.
So, but you have to bring them forth into a reality. So we said, yes, until it gets controlled, it will be controlled, but it's not full cure, but it will get controlled. But till then, you need to take your medicines. So the main gist behind every role play is you need to suggest, you need to advise, do not command, right?
Yes.
Yeah, and then empathize and reassure the patient. I think when you get all these things into your hand, and when you practice like this, definitely you'll be able to get a very good mark for your OET speaking, right?
Yes.
Okay then. Bye.
Bye.